So today I want just to give a short update about my current situation. The last week was very good. Um, I was on the boat, as you could see on my last video, and yeah, it's really, really good. Yesterday was not that good because I was at the gym on Sunday, and every time 2 days after the gym, my body shuts down a little bit. The muscles doesn't work correctly. But today it's very good. And before I had the skull fusion and only the C1, C2 fusion. mm, I needed a longer time for recovery after training session. So that was the reason why I didn't want to train anymore. So last year I trained maybe about 10 times. Um, yeah, and now after the Sky Fusion, my body is much stronger. I had with my neurosurgeon and told him about my situation, and yeah, he was really happy that I feel that good. And yeah, I hope it will get better. So another thing I want to talk about today about is my diagnostic. So many people who saw my YouTube channel asked me how I got the diagnostic for all these operations, and yeah, um, in August 2022, I was in Spain, in Barcelona, at Dr. Oliver. And there I did a CBCT scan. So this is a scan in an upright position where I was sitting like this and moved my head like this and this. And there I got yeah, my complete diagnostic. And I want to show you my diagnostic protocol. Um, so you can see it here. So there you can see I had an injury, a car accident, and yeah, my symptoms. And you can see that when I laying down, I had an CXA angle of 140 degree, and yeah, this is not that bad. Um, but in upright position, yeah, in upward position, the CX angle moved to 130 degree, and this is not normal. So it has to be over 135 degree and not below. So when it's below, there is a danger of a compression of the spinal cord. So every time when I look down, yeah, there can be a compression of the nerve in the brain. And that was the reason why I'm feeling so bad the whole time. And yeah, the BIA and BDI there in this situation was normal, but the main problem was that C1 and C2 had a joint displacement of 10.5 millimeter, and that is too much. So every time I move my head from yeah this to this, I can't do this anymore because of my fusion. Um, it moves too much and compresses the nerves, and that was the reason why I feel so incredible bad. And every time I moved my head, it's hard to describe. It was just like a car drove over my neck every time. So I tried not to move my head that much. And when I did it too much, I just could lay down, and my neck felt so unstable and I couldn't hold my neck. Yeah, and with this document, I went to Professor Rode in Göttingen, and he did another CT scan in a laying down position, not in an upright position, and it nearly showed the same. And this was the reason why I'm getting the fusion of the, C1 and C2. And he told me we try this fusion first, because after I will still have movement of my head, and yeah, I'm young and maybe it's enough. So his meaning was that I maybe doesn't need the skull fusion. Yeah, so we did the fusion of C1 and C2 in November 2023. Yes, and yeah, the rotation was fixed then, so I couldn't rotate my head anymore. Um, but then when I woke up from the fusion, from the operation, I felt immediately that this movement is worse. And I told him, and he explained me that I have to wait maybe a little bit, and it will become better, but it didn't. And this was the reason why I did another upright MRI here in Germany in uh, September 2024. And I can show you my upright MRI pictures. You can see a little bit bad. Yeah. Um, but here you can see the BDI and BIA angles, and here the difference of the two measurements were too much. So when the difference between this movement and this movement, so flexion and extension, was too much, and my CXA angle, so here you can see it better, was 131 degrees, still in neutral position. And because of the fusion of C1 and C2, the problems above, so yeah, the skull at C0 and C1 became worse. And yeah, I felt it, like I told you, when I did this extension and flexion movement. Um, I still felt like my head is dropping the whole time and I can't hold it. And and therefore, we decided to do the skull fusion in November 2024. Yeah, and now the problem is fixed. So I don't have a stability, an instability anymore. It's completely fixed. Of course, my body still needs time to rest and to feel better, because this injury, when it's fixed, it doesn't mean that the whole body is healed from one to another day. It needs more time, so about 1 year or 2 years healing time, but I still feel much better. So incredible better than before. my head just holds where it is. I don't have the feeling that I'm losing my head the whole time, and I have much more blood in my head. And yeah, it's nearly perfect. So, especially the last 2 weeks, I felt a huge improvement. Um, Strange in my body is back. The strange in my legs are back. Um, and my lower neck is still feeling a little bit unstable sometimes. Therefore, I get a PRP session on Friday in Belgium. So in 2 days, I want to try it. And yeah, I can show you some more pictures. How I looked before my C1, C2 fusion. So this picture here is after the chiropractic treatment. So everything was complete out of line. So nothing was straight anymore. And my head was completely fucked up. So I couldn't move it. It was just somewhere, and I didn't know where my head is. Um, Here's a picture how I looked after the wrong chiropractic treatment. So he nearly killed me. Uh, yeah, this was the worst decision in my life. Um, I would no one recommend to do a chiropractic treatment on his neck. So chiropractors, no good people. I wouldn't visit one anymore. Here you see how bad I looked, how ill I looked sometimes before my fusion. Yeah, yeah, I really looked fucked up when I do something physical. Here I try to build. Yeah, yeah, it was a really hard time. Here you can see a picture of me how I looked before my C1, C2 fusion. So my face was very swollen the whole time because the blood couldn't move somewhere, and I was the whole time in this position, and I looked incredibly sick. My eyes are red. Uh, yeah, again. Um, Here you can see the scar of my C1, C2 fusion. So it's not very big. And here you can see the scar of my skull fusion. So it's much bigger. Yeah, really much bigger. I don't had pain, so and I didn't took a lot of medications. I never had much pain during the 4 years. I just felt every day like, yeah, I was dying, but I didn't have any pain. Yeah, it's more like the feeling that you can't think you correctly, that you have brain fog, that you are tired the whole day, but never had any pain. Here you can see the C1, C2 fusion. Here C1, C2. And when I got the extension to the skull and C3, they removed the screws in C1. I still think it's not maybe the best idea to remove the skulls in C1, but yeah, they did it because they could bend the roots better. Um, patients who get now the operation, yeah, they fuse C1 every time, so they put screws there too. Uh, let's see if there will be a bone fusion in my case. If not, then there has to be screws again. But for the moment, it's okay. So here's the C1, and yeah, there were the screws before, and they removed it. Mm, let's see. Um, yeah, that's all the pictures I wanted to show. Mm, I'm really looking hopefully in the future, and I still think I will have big improvements. Um, next update I will give you on Friday, maybe on Saturday after my PRP treatment for my lower neck. Um, I'm a little bit scared maybe because I don't want to worsen my situation. But yeah, I've spoken with some patients, and they all were very happy to did this treatment. Mm, yeah, and the next good thing is that I will work next week again on Monday. Um, Ready to work again. Of course, I'm still a little bit tired, but yeah, it's not like before. So before it was just completely shit, and now I just feel good, insane good, and yeah, you could see it on my last video where I was on the boat. I was incredibly happy, um, and day after I walk through the forest, and yeah, I just was fit and not tired, and everything was nearly fine. Yeah, that's my current situation. Thank you for watching, and if you want to ask something, you can do it. As always, you can write some private messages or just comment the video. Goodbye and have a nice day.